Brain abscess is becoming more and more common in the recent times. It is nothing but an infection that has spread very aggressively inside one's brain. What is an abscess? Abscess is a collection of purulent material, pus-like material due to an infection inside one's brain, and that causes increased pressure in the brain and damages the brain. What causes brain abscess in young children? The most common cause in young children is meningitis, that is infection inside the brain. Second cause would be congenital heart disease, that some children are born with some defects in the heart which predisposes them to develop such brain infections or abscess. Third would be an ear infection and sinus infections around the nose and the paranasal sinuses. Fourth is presence of a very low immunity in certain children who are probably HIV positive or who have leukemias. And the last important cause is presence of a dermal sinus tract, which is present in the lower back. In some children, there's a small opening which can cause infection to go from outside inside into the brain. What are the symptoms of a brain abscess? A child with brain abscess will have high-grade fever, seizures, irritable behavior, and stiffness in the neck. Most likely your pediatrician will be able to diagnose it based on the child's clinical feature, or sometimes he may do a procedure called as a lumbar puncture to confirm the diagnosis of an infection inside the brain. For diagnostic confirmation, we also require an MRI scan with contrast to look at which part of the brain is having the infection and how much big it is. The treatment basically involves doing surgery to remove that purulent infective material from inside the brain, and the child will most likely require antibiotics for around 4 to 6 weeks after the surgery. The infected material that we get during the surgery is sent to the lab for doing culture analysis. Based on the culture, that we are able to say which bacteria is growing inside the brain, and then we can give the child the appropriate antibiotics for the 4 to 6 weeks duration.